Hi, I'm Dr. Anoop Rawool, consultant medical geneticist at Fotis Hospital, Mulund. So, in what ways medical genetics services can help cancer patients? So, most importantly on two fronts. One is the cancer treatment per se, and second to identify whether the cancer is hereditary and investigation for hereditary cancers. So, that is the second important aspect. So, let us try to understand the first aspect. When we try to help or assist the oncologist in the treatment of cancers. So if any patient is identified with specific cancers, so usually the mode of diagnosis is by doing a biopsy and histopathological studies. Based on that, they do the staging, the histopathological what grading it is, and clinically cancer kahan tak फैला है वो देख के staging. And बेस्ड ऑन व्हाट ऑर्गन, किस ऑर्गन का कैंसर है, क्या स्टेजिंग है, उसके हिसाब से देन फर्दर इन्वेस्टिगेशंस आर डन एंड देन कम्स द मॉलिक्यूलर जेनेटिक स्टडीज. सो सपोज वी हैव अ पेशेंट विद से ब्रेस्ट कैंसर और कोलोरेक्टल कैंसर और prostate cancer. So in these cancers we take the blocks and we do molecular genetic studies to identify, so is there any specific genetic abnormalities in the cells, in those cancerous cells, which can be targeted. So to simplify, we try to identify ki, is there any drug which will particularly act on those cancer cells without affecting the normal cells, or we try to avoid the side effects. So that is targeted therapy, and it is very important that when such test is done, that we do a pre-test genetic consultation and counseling and post-test, so as to understand what test is being done, what is the utility, what are we going to look for, what could be the implications and outcomes beforehand before doing the test. And similar session we have once we have the reports of those tests at hand to understand what are the findings, what is the meaning of those findings, and how it is going to affect the treatment. And all this happens in conjunction with the oncology department. So it is the oncology department who is taking care of the treatment part. We help them and the patients in formulating the treatment. So that is molecular genetics aspect of the treatment part. Next, the most important aspect is whether the cancer is hereditary. So there are certain clues which you can look in the family to find out whether this cancer is hereditary or inherited. So more than one member in the family having cancers, or same person having two cancers of related organs, or there is a recurrence of cancer at a young age, earlier age, or unusual cancers like male having breast cancer, prostate cancer in the young. So cancers of related organs like breast cancer, ovarian cancer, or colorectal cancers, pancreatic cancers, gastric cancer. So these are the clues. And if such history is there in the family, you should seek medical genetics consultation to undergo evaluation and testing. So the point is, if indeed it is inherited or genetic, and we do a genetic test and identify, so we can put the patient or the individuals at risk at proper surveillance and follow-up. So the idea is to diagnose the cancers in these people as early as possible. So the earlier we diagnose, the treatment becomes easier and the outcomes are good. Thank you.